इस्तेमाल है आपका फैट पाँव को और अपनी हील को मिला के एक स्ट्रेट लाइन पे चलें, विच इज़ टेंडम वॉक, और वो इम्पॉर्टेंट है टू मेंटेन द बैलेंस। और फिर फ्लेक्सिबिलिटी एक्सरसाइजेज हैं, लाइक योर मेडिटेशन है, योगा है, और ये तमाम एक्सरसाइज। तो एक्सरसाइज का डेफिनेटली रोल है। और फिर एक और जो कंपोनेंट है वो स्लीप का है, लेकिन इट शुड बी एडिक्वेट स्लीप। अंडर स्लीप और ओवर स्लीप दोनों जो है वो ख़तरनाक है। और जो लाइफ एसेंशियल 8 में उसमें एक कंसेप्ट स्लीप का भी था कि एडिक्वेट स्लीप अकॉर्डिंग टू द एज, बट इट शुड बी बिटवीन 6 to 8 आवर्स। लेस देन 6 आवर्स स्लीप, मोर देन 8 आवर्स स्लीप, उनके अपने नुकसान आते हैं। और एक बड़ा फैक्टर जो है वो आपका ये तमाम जो चीज़ें थी अभी तक हमने डिस्कस की, दे वर रिगार्डिंग द फिजिकल हेल्थ। तो मेंटल हेल्थ भी इंपॉर्टेंट है, और ये भी उतनी ज़रूरी है जितनी आपने फिजिकल हेल्थ को मेंटेन करना है। दिस इज़ वन ऑफ द मेन ऑफ योर फंक्शनल एबिलिटी, कि पेशेंट शुड बी एबल टू बिल्ड रिलेशनशिप, पेशेंट शुड बी एबल टू ग्रो, थिंक एंड रिएक्ट अकॉर्डिंगली। बस ख़त्म हो गया। और ये आपकी टिप्स हैं जो आप कर सकते हैं कि वो काम करें जिसको आप प्लेजर हासिल करते हैं, एंजॉय करते हैं। और फिर इंडल्ज योरसेल्फ इन डिफरेंट ब्रेन एक्सरसाइजेज। और ये ब्रेन के बारे में इंपॉर्टेंट चीज़ है, यूज़ इट और लूज़ इट, इस्तेमाल करते रहना चाहिए। और डिफरेंट ब्रेन एक्सरसाइजेज जो हैं कि उसमें आप कोई और लैंग्वेज सीखें, और हमारे लिए बड़ा आसान है कि अपनी आदत बनाएं कि कोई कुरान की 1-2 आयत को रोज़ाना याद करना शुरू करें। ये आपके लिए बहुत अच्छी एक्सरसाइज। और ये 4-5 बड़ी टिप्स हैं कि अपना कोई नया स्किल शुरू करें योगा में, और इस किस्म की बाकी एक्टिविटीज में आपको इन्वॉल्व करें, अपने आप को सोशलाइज करें और रिड्यूस योर रिस्क। फिर जो डिफरेंट आपके बिहेवियर्स हैं डेंजरस किस्म के, अवॉइड स्मोकिंग, अवॉइड अल्कोहल। और सिमिलरली ओल्ड एज में समटाइम दीज वैक्सीनेशंस दे बिकम इम्पॉर्टेंट। जैसे आजकल का सीज़न था स्मोक का, तो उसमें जो एल्डरली पर्सन थे उनके लिए फ्लू की और निमोनिया की वैक्सीन, इट विल बी हेल्पफुल। फिर मोस्ट ऑफ दीज पर्सन दे आर हैविंग अदर मॉर्बिडिटीज़, तो उनको भी जेन में रखना है आपने। और फिर पब्लिक हेल्थ और जो डिफरेंट गवर्नमेंट लेवल पे जो और कम्युनिटी लेवल पे जो मुख्तलिफ मेजर्स हैं, दे डू प्ले अ रोल। सो दिस इज़ द टेक होम मैसेज इन सिंपल वर्ड्स। अपनी फूड को, अपनी फिजिकल एक्टिविटी को और अपने माइंड का ख्याल करें। और आखिर में जस्ट कि अभी तक हमने बात की लाइफ एक्सपेक्टेंसी की, कि हमारी उम्रें बढ़ गई हैं, लेकिन ओवरऑल जो है लॉन्गेविटी उस पर भी फ़र्क पड़ा। वी वर टॉकिंग अबाउट क्वालिटी ऑफ लाइफ। तो इज़ देयर एनी इफेक्ट ऑन क्वांटिटी ऑफ लाइफ? अनफॉर्चुनेटली नॉट। जो हमारी अपर सीलिंग है उसमें बहुत सारी चेंज नहीं हुई, और स्टिल दैट सीलिंग इज़ फिक्स्ड एट 115। और फीमेल में दे कैन लिव अप टू 115.7 ईयर्स, और मेल जो थोड़ा सा कम उनको ज़िंदगी मिलती है तो 114 साल। और जो वर्ल्ड रिकॉर्ड है बीबी का, जिसने सबसे लंबी ज़िंदगी गुजारी, ये फ्रेंच लेडी थी, और ये 1875 में पैदा हुई और 1997 में डेथ हुई। 122 साल की इसकी उम्र, डेट इज़ द मैक्सिमम। तो एक मैं जो बात करना चाहूँगा कि अभी हमारे जो स्कॉलर थे वो बात कर रहे थे कि 2 चीज़ें जो इंसान जिनके बारे में कंसर्न होता है, एक तकदीर है और एक उम्र है। तो तिरमिज़ी की हदीस है कि दुआ एक ऐसी चीज़ है जो आपके मुकद्दर को, आपकी तकदीर को चेंज कर सकती है, और नेकी ऐसी चीज़ है जो आपकी ज़िंदगी को बढ़ा सकती है। थैंक यू वेरी मच फॉर योर पेशेंट लिसनिंग। थैंक यू।
Assalamu alaikum. Thank you so much, Professor Dr. Zafar Iqbal Saab, for his beautiful, engaging and insightful presentation on the topic of healthy aging. Now, I would like to invite our next worthy speaker, Professor Dr. Junaid Sarfraz Khan, Professor of Medical Education, Health Services Academy, Islamabad. His topic of presentation is Medical Education and Islamic Missions. Sir, please come on the stage.
Kindly try to conclude on the time. Give me time. We are already short. नहीं sir. किधर है यार इसका? Sir. तीसरी
नहीं ये भी नहीं ये My profound thanks to the Muslim Medical Mission for inviting me here today to speak in their August conference, in their August gathering. It's a pleasure, and up till now I've had a very enlightening session here, so I've learned a lot of things. So my talk is going to be on incorporating Islamic principles in medical education, and this is a disclaimer. I'm a practicing Muslim and a clinician, a medical educationist. I am a student of medical professionalism, but I'm not a religious scholar. So my talk, whatever I'm going to say, whatever I'm going to interpret, should be us peraye ke andar ke. I'm not a religious scholar, but whatever talk I'm going to give here is based on my observation, on my research, on what I have read, and what I understand about incorporating Islamic principles in medical education, being a student of medical profession, as well as a practicing Muslim. So how we're going to proceed in this presentation. We're going to talk about Islam being the complete code of conduct of life. We're going to talk about profession. What is profession? What is medical professionalism? We're going to talk about the models of medical professionalism, how society believes medical professionalism, what does it mean, and how to incorporate Islamic values in practice of medicine, and eventually we are going to come up with a contextualized model for medical professionalism in this talk as well. So we, as Muslims, believe that Islam is the complete code of conduct of life, and it guides people in all aspects of their lives, including socio-cultural, ethical, legal, spiritual, etc. So it's encompasses our life completely, our entire personality, value system, so that it gives that to each and every individual. And what is medical profession? So to understand medical profession, we need to understand what a profession is. So profession is not unique to medicine. So koi bhi, like plumbing is a profession, engineering is a profession. So if you have a unique body of knowledge, a unique skill associated with a group of individuals, and a certain attitudes related to the delivery of that knowledge and skills, and that community is custodian of that unique body of knowledge, skills, and attitudes, then that is a profession. And since we are a custodian of a unique body of knowledge, skills related to medicine, and certain attitudes in the delivery of that knowledge and skills, we belong to the community of medical practice. There are various frameworks that identify or define what medical professionalism is. And this, for example, is a Western framework or model for medical professionalism. And the interesting thing about even the Western model of medical professionalism is that the clinical competence, that the knowledge and skills associated with medicine is only just the foundation, or a very limited portion of what the entire framework of professionalism is defined by them. The large majority of the rest of the framework deals with how we basically deal with ourselves, with other people, with our patients, with the society around us. So that's a very important thing that we should remember. So just having the knowledge of related to medicine and the skill to practice medicine is not enough. There are certain attitudes, there are certain value systems, there's certain morality associated with the delivery of that practice. And the same goes with the certain other models of medical professionalism. For example, the Chinese model, which also identifies competence as a very limited area, but a large amount of medical professionalism framework is defined by other areas, including humanity and professionalism, altruism, and other areas, and further refined by the Peking University. It sort of projects the same idea there as well. So the reason for giving you these various models around the world is that even outside the Islamic world, people believe that value systems, morality, how we practice medicine, how we interact with other people, with our peers, with our seniors and juniors, and with our society has a very important component within the practice of medicine. Even in Japan, for example, they have a strict Bushido code in which They touch on 7 areas which, if you look at it, the majority of those areas, rather the entirety of those areas are related to things that are related to the value systems rather than the competence related to medicine itself. The Arabian model, also the 4 gates model presented by Al-Iraqi in Saudi Arabia, is also sort of focuses on self-awareness, self-management, excellence and commitment, keeping professional confidentiality, self-accountability is very important, and self-motivation, expecting reward from God and not people. So when we talk about the Islamic perspective, so there are hukuk Allah and hukuk al-ibad, and at least I'm a firm believer when we say कि Allah Ta'ala बहुत सारी चीज़ें माफ़ कर देगा हमें, तो वो that relates to hukuk Allah, but not our जो हम अपनी गलतियाँ करते हैं related to hukuk al-ibad. And that's also sort of presented in our Sharia law. But what does the society and profession in Pakistan think about what medical professionalism means and how it is related to the Islamic perspectives and the principles and value systems of Islam? So there was a large study that was conducted in Pakistan, more than 53 focus group discussions, including more than 600 individuals, stakeholders, policy makers, doctors, allied health sciences teachers, students, as well as patients all across Punjab. And they came up with very, so some of the quotes I'm presenting here that came out of that study. So it was a qualitative study, and therefore it is presented in codes, and there were certain themes that were derived from that study. So as you can see, a large number of individuals, whether they were educated or not educated, whether they were patients or policymakers or doctors, attributed a large amount of value system to their understanding of how medicine should be practiced. So Allah Almighty is watching us and our attitude towards everyone, and we are responsible for our deeds. If no one else is watching us, we as Muslims believe that Allah is watching us. Religion also affects the behavior, but we don't have the proper religious knowledge. And even if we do not practice it. So just having knowledge of religion is not enough. The most important thing is execution. Fear of Allah Almighty keeps us from doing wrong. A doctor that fears the day of judgment will never harm his patient intentionally. For a doctor, professionalism, it is not enough to have desired experience, but ethics does matter a lot. So these are quotes from that study, and there were hundreds of similar quotes from that study. And what themes were derived out of these quotes from this qualitative study? The most important themes were value-driven, which included spirituality, morality, and humanism. There were other themes related, like competent and responsible professional, effective manager and effective leader, and being supported. But values was a very important pillar that came out of that qualitative research. And basically how they defined it was that a medical professional is encompassed by certain values that are related to morality, to spirituality, and to humanity. And in those values, the focus was on Islam as the source of moral and professional values, belief in divine healing, belief in divine retribution, empathy, sympathy, and kindness, showing humility and respect, conscientiousness, a belief in inclusivity that we talked about earlier as well in one of the talks, maintaining a balance between ethics and cultural norms, and dealing with cultural taboos with morality and ethics. But importantly, Islam as the source of moral and professional values. So all that morality, all those values, all those moral compass comes from the Islamic principles and from the values derived from Islam. And the reason they said that was a person who believes in a certain degree of external accountability, fears Allah, fears from the day of judgment, will hold himself accountable and will believe that if he does harm to any patient, to his peers, to the society, to his profession, will be accountable not just in this world, but in the world hereafter. So that is important. But one of the important themes, one of the important aspects of this value-driven system of medical professionalism is that is related from this quote. I see my fellow professionals observing stringently the timing of 5-time communal prayers to be very religious and at the same time practicing medicine quite unethically. So they identify that there was a gap between what they internalized as being Muslims and how they actually externalized those value system in their practice in their daily dealings. And that's where we come up with how we can teach and inculcate Islamic values in our undergrad or postgrad education on our daily lives. So in a curriculum that we teach in undergrad or postgrad education, there's a formal curriculum, there's an informal curriculum, and then there's a hidden curriculum. The hidden curriculum are all those attitudes and all those behaviors that people learn from their peers, from the culture within that institution, from their role models, and from their usatza. So अगर हम खुद ही पंक्चुअल नहीं होंगे, हम खुद झूठ बोलेंगे, अगर हमारी डीलिंग विद पेशेंट गलत होंगी, हम साइफन करेंगे पब्लिक पेशेंट्स को प्राइवेट पेशेंट्स, विल बी टेकिंग मनी एंड गिफ्ट फ्रॉम पेशेंट्स, वी विल बी कॉन्स्टेंटली bickering and fighting with our colleagues over various aspects of our lives. We will not be the role models that our coming generation of medical professionals will be able to internalize those values. So हमने behavioral sciences, University of Health Sciences में आपको शायद याद हो कुछ लोगों को 2007 में शुरू की, and then we carried it that study to identify कि उसका फायदा क्या हुआ over the next 5 years के बाद जो लोग graduate हुए, तो we tried to identify कि उसको कोई फायदा भी हुआ, and we realized कि आपने उनको जो कुछ पढ़ाया है उसको कोई फायदा नहीं हुआ. But because once they hit the actual place of work, they did exactly what everybody else was doing in that place. So ना वो consent लेने का, ना वो communication skills का, ना वो confidentiality का, उनको पढ़ाने का किसी किस्म का कोई फ़ायदा नहीं हुआ, क्योंकि उनके role models, उनके workplace, वो culture, वो उस तरह का exist ही नहीं करता था. So role modeling, being good role models with Islamic values is important to incorporate those values in our coming generation. And this is a framework that I would like to present. जिसके अंदर सिर्फ knowledge, skills and attitudes जो हैं related to medicine ही नहीं, but Islamic code of conduct and morality, humanity, values and ethics related to that code of conduct should be part of the role modeling system. And the same here as well. And we come to the end of the presentation. Thank you very much.
Thank you, Professor Dr. Junaid Sarfraz Khan, for his useful insight. Now I would like to invite Professor Farooq Afzal, Professor of Surgery at LGH Hospital. His topic of presentation is obesity, its prevention and management. Sir, please come on the stage.
Thank you very much. Right, thank you so much. First of all, I must thank Dr. Nasir Hamdani for the invitation. It's a great opportunity to meet and I think share the knowledge and expertise here. So WHO recently issued the global burden of the disease. They identified 87 risk factors. And the top 3 risk factors for non-communicable diseases are, number 1 is obesity, number 2 is fasting plasma glucose, and number 3 is air pollution or pollutants. And we see that in this country, we are facing all 3, right? So this is important for that reason that we should be talking about. And my talk is basically made easy because of the 2 previous presentations by Dr. Javed Akram and Professor Zafar Iqbal, and that is basically gave me a preamble of what I'm going to talk about. So what I'm going to talk about is only 3 things. What is obesity? How can we prevent it? And what is the current management of obesity, right? So we all know that current, like COVID was an epidemic, obesity is an epidemic. So 1 in 8 persons are basically are obese in this world, right? And almost 1/4 of the world population, 2.5 billion people, are currently obese. And that's not only adults. Look at the children. There are 390 million children in the world over the age of 5 to 19 who are obese. So the magnitude of the problem is huge, humongous. There has to be something which needs to be done. So what is the definition? What is obesity actually? So simple definition by WHO, it is a chronic complex disease defined by excessive adiposity that can impair health. And I see very resemblance to cancer. Cancer is a lifelong disease with risk factors. Similarly, obesity is a lifelong disease with risk factors, with remission and cure, and etc. And what is the underlying fundamental problem? The underlying fundamental problem is dysregulated energy metabolism and a higher set point of fat mass or weight. So you have a higher weight or set point of fat mass. Whatever you do, right, you want to lose weight, it goes back to that set mass. And that's the problem which we need to address with the present management strategies. Now, for all of you who understand some of the physics, the first law of thermodynamics is that the internal energy state is constant. So energy in should be equal to energy out. So what is happening in the body? So we are taking the calories, so calories in has to be equal to calories out. Now, calories in is what we eat, and calories out is the energy expenditure. And most of your energy expenditure is spent on your metabolism, right? So basal metabolism. And the rest is on thermogenesis and a little bit on physical activities, right? Now, there are feedback mechanisms. Now, if there is higher calorie intake, there has to be a feedback that the person has to have increased energy expenditure. Or somehow the other, if there is energy expenditure which is going down, your calorie expenditure has to be come down, right? So there is a dysregulation at that level, which we do not understand fully, but this is all happening here in the brain. So brain is the organ which is controlling your weight, and the dysregulation of energy metabolism is happening at this level. So this is just a simple diagram for you to give you an understanding that it is not the fault of any one of you to be obese. There is an interaction of genetic, then epigenetic, which are basically from getting from the environment, right? And these basically are affecting the energy metabolism, which leads to lipid accumulation and at the same time inflammation. And in the presence of insulin resistance, that leads to adiposity. And there are 200 diseases associated with obesity, but fundamentally, type 2 diabetes, cardiovascular diseases, cancer, and aging, just mentioned by Dr. Zafar, has a huge impact because of obesity. Now, fundamentally, the molecular basis, you just have to understand that the weight is controlled by the brain, the hypothalamus. So hypothalamus is getting two signals. If there is an energy, you have an energy balance, a deficit, what is happening is your hunger satiety hormones, hunger hormones basically are stimulated. And if you are having more fat mass, your satiety hormones are stimulated, and there is producing a control. So two hormones, leptin and insulin, are basically playing a role in your energy metabolism. Unfortunately, both these hormones are resistant in obesity, right? And that is the reason you have a higher fat mass setting. Now, what are the traditional ways of measuring obesity? So we use body mass index, but this probably is not the best way, right? So there are other ones for Asian, I think waist circumference. So for American, a male a waist circumference of less than 40 is the ideal, and a female of 35. Whereas for Pakistani population, I think 90 to 94 centimeters, so which goes about 36 centimeters. Everybody who has a waist circumference of male having more than 36 centimeters is not a good, is obese. Similarly, the third parameter is percentage of fat mass. So a male should have a percentage of fat mass of less than 25%. But this fat mass can be measured by either DEXA scan and other measures. So these are the three surrogates of adiposity or measurement of obesity which we use. Unfortunately, body mass index is commonly used by most of the Western criteria, but it's not a perfect one. I think waist circumference is much better. Now, if you consider Asians, we are different from the West, because for the West, the BMI is, it should not be less than 18 and should not be more than 25. For the Asian, the BMI cutoff is 23, right? So if you are from 23 to 27, you are overweight, and anybody who is more than 27.5 is considered an obese individual. The other thing is that the obesity in South Asia, including Pakistan, Bangladesh, and India, is totally different from obesity in the West. There is a YY syndrome. There are two authors with the name, their first name started with Y. They both had the same BMI, but they had a different fat distribution and weight circumferences. So this means that the Asians have double the amount of fat with the same BMI, higher risk of metabolic syndrome, high risk of major cardiovascular events. So we are, despite we look thin, we are having a higher metabolic burden. And Pakistan is not unique. Pakistan is unique in another word, because we have a double burden of the disease. We have malnutrition causing diabetes, causing tuberculosis and deaths. And on the other hand, we have overnutrition causing it. So this is a study, global study done by many authors, but one of them is Pakistani, Zulfikar Bhutta. Pakistan is probably the ninth leading nation having a large amount of obesity, but at the same time, the malnourishment. So we have double burden of the disease. Okay, so after the definition of what obesity is, what should be done? So prevention is the best, right? And Dr. Zafar Iqbal's talk has made my job easier, because prevention strategies are basically modified based on lifestyle modification. Now, since it's a global epidemic, WHO has started a prevention of obesity initiative, right? And what basically is this initiative is that they are focusing from the conception of the baby right to their adult, right? So that's why medical students, they are great proponents of this initiative. And what they're focusing on is the breastfeeding, right? Then there should be limited consumption of sugar-sweetened beverages and energy-dense foods, and more use of increased consumption of like fruits and vegetables, and maintaining a healthy life. And for that reason, WHO started this WHO Acceleration Plan to Stop Obesity. In the 75th Assembly 2022, this basically is a whole society approach. So not one individual can do that. It is the job of the government, the society, the family, and everyone to basically take actions as necessary that should stop the rise of obesity. And that includes taxes on the sugary drinks, improved food labeling, and promoting physical activity, and that can be monitored by the impact cycle they've created. So there is a global awareness that this problem has to be undertaken, and if not undertaken early on, then we are going to have huge number of other problems such as diabetes and cancers and other stuff. Now, what are the different ways we can manage this? So standard ways are, number one, the lifestyle modification. Number two, medicines like drugs. And I'll talk about, Dr. Javed Akram has made my job easier, that the non-surgical procedures like implants and endoluminal procedures are in the market. And now we have weight loss surgery. Since the advent of laparoscopic surgery in the last 2 decades, this weight loss surgery or bariatric surgery has impacted the outcomes of obese patients. Now let's come to the lifestyle modifications, right? So diet. So what is the most efficacious way of losing weight, right? It's producing calorie deficit. And the proven calorie deficit can only be produced by a diet which is called VLCD, very low calorie diet, right? And then there's a role of intermittent fasting as well, which is not set clear. But if you put Islamic guidance, it is recommended that should have fasting maybe every month or every 2 months, because fasting improves your glucose and other health parameters, and I think it should be recommended. Exercise, Dr. Zafar already talked about. The strength exercise is important. Your muscles help to basically absorb the glucose without the help of insulin, and that helps to basically build up of this glucose. Then the other factors are stress reduction and good sleep, right? And new epidemic of like screen. All of us are all the time fixed on it, and especially in kids. So this screen time is also adding to the adolescent and kids' obesity at the same time. And you should avoid prolonged sitting and avoid alcohol and smoking. So these are the lifestyle modifications which does play a role in prevention of obesity. But if the lifestyle modifications are not helpful, then you can think of adding drugs. So there are three types of drugs already in the market. One, those who act in the central and suppress your appetite. One who act in the periphery and decrease malabsorption of fat, etc. And the third one, which are new into the market, they increase your energy expenditures. And they are the GLP-1 agonists or analogs of the one. So I will talk about two drugs. And since it's the evidence-based medicine, so first drug which I want to talk about is semaglutide, although there are other GLP-1, but just focus on this. So there are 7 trials which are designed for this drug, right? So we have collected data up to 5 trials. These are called STEP trials, and STEP stands for semaglutide treatment effect on people. So trials have shown that semaglutide leads to 10 to 15% of weight loss if you take it for 24 months with incrementally increasing dose. But in step 2 trial, what we found that once the other group stops semaglutide, it starts to regain the weights, right? So that's the problem with these drugs. A better drug is tirzepatide, which is basically a GIP and GLP-1 analog. And a recent Sermon trial, which was published last year, it has better data as compared to semaglutide. So tirzepatide in the name of Mounjaro, or one of my friends came from UAE, and in UAE it is like just everywhere in the market, and it was so much that every woman, they wanted to go to a party and they wanted to reduce about 10 to 15 kg of their weight. They take Mounjaro, right, the 2 to 3 months, lose the weight, and enjoy the party, and then come regain the weight again. So this is a new thing in the market. And because of these medicines, what has happened is that the bariatric surgery has gone down. So 25 to 30% reduction in bariatric surgery. And there is a 130% increase in the prescriptions of these medications. This is a US data just published on 25th of October in JAMA. Now, the most effective weight loss method is surgery. And we have this Swedish obesity study, which has probably more than 25 years prospective data, that the long-term waste is only possible by surgery. And presently, sleeve gastrectomy is the #1 surgical procedure, which works on caloric restriction formula. There are other procedures that work on malabsorption, and there are procedures that work on both. But there are not only caloric restriction, there are hormones, especially the GLP-1s, like hormones, which are playing a role in. So every mechanism, what are they doing? They're trying to do 2 things. #1, they're increasing your satiety, and #2, they are decreasing your appetite. So the most effective ways is only 2 ways. All right, so simultaneously, what we've seen that the diabetes, Professor Javed mentioned Pakistan probably would be 3rd largest country. Right now, there are 27% population of Pakistan is diabetic, and almost 90% of diabetics are basically overweight or obese patients. So what do we need to do? Well, that led to the birth of metabolic surgery. We thought that the diabetes only of the dysfunction of the pancreas. Actually, if you alter the gut in a way that it produces more GLP-1, you can basically impair and you can improve the outcome and maybe sometimes cure the diabetes. So that led to the birth of metabolic surgery. And we have lots and lots of evidence. This book called meta-analysis of about more than 135,000 patients. And this JAMA study of 162,000, both huge meta-analysis and level 1 evidence telling that metabolic surgery is far better than the medical treatment for the treatment, especially of the obese diabetics. Now, there is a recent trial, the results just published last week, and that is about the microvascular outcomes of metabolics. So traditionally, we were treating drugs separately than surgery. Now, this study, where they compared the best medical treatment with best medical treatment plus Roux-en-Y gastric bypass, and the 5 years data are far superior in the combination group. So there was better kidney function, more weight loss, better glycemic control, and quality of life with the combination therapy. So that has led to the change of algorithm. Now, after the bariatric surgery, we're thinking that combined medical and surgical therapy is the new standard of care. So lifestyle modification, drugs, non-surgical procedures, bariatric surgery, but the current gold standard is bariatric surgery in combination with these drugs, which we talk about GLP-1. So I leave with this summary of this. The important thing which you have to remember that obesity is a complex disease. It is not a fault of you. It is the obesogenic environment plus your genes that helps you to basically become this. And the fault is not in your stars, the fault lies into your genes and epigenetic. And I think we need to focus more both on the personal endeavors as well as societal endeavors to basically get rid of this menace. Thank you so much.
Thank you so much, sir, for sharing your expertise. Now I would like to invite our next worthy speaker, Professor Dr. Mohammad Salim, former Medical Director, Institute of Child Health, Lahore. Sir, please come on the stage. His topic of presentation is Leadership in Healthcare with Islamic Perspective.
Bismillahirrahmanirrahim. Nahmadu nusalli ala Rasulil Kareem. Assalamu alaikum. There is a lot of talks today. Dr. Janeer Sarfraz made my job easy. He discussed medical professionalism or medical ethics in Islamic perspective. And when I talked to Dr. Hamdani that I want to give a talk on medical leadership, he said, give a talk, medical leadership in Islamic perspective, leadership in healthcare in Islamic perspective. I am not a religious scholar. It is a very difficult talk. In the literature, there is no literature available over it. I have not seen any of the article on Islamic perspective of medical leadership, but this is the hot topic nowadays. Medical leadership topic is also scanty, but in the last few years, there is a lot of written on the medical leadership. I will ask you, how many do you feel you are leader in the hall? Only one. Two. Whenever we are said that you are leader, we feel we are not leader, only political leader. Everyone is leader. You have to play your role as a leadership in the health professional, and while you are treating the patient, while you are teaching the student, while you are training your resident, you have to play a leadership role. Now we will go through this presentation. ये इसको रन करें भाई, ये बे नहीं कर रही. There is only 15 minutes. और अगर हम इस presentation के end पे convince हो जाते हैं only 10% के we are medical leaders, तो मैं समझूंगा कि मेरी talk करने का कुछ ना कुछ फायदा जरूर हुआ. किसमें? अच्छा ठीक है. तो the aim of this presentation is to discuss the background of medical leadership, what we mean when we say medical leadership, how Islam defines a leader, and what are the leadership qualities in Islamic perspective, contribution of old Islamic leadership in healthcare, how it can influence the healthcare leadership, application of medical leadership skill to daily practice, and how we should develop leadership skill, challenges of medical leadership in the physician. Background, you are poorly or less taught in undergraduate curriculum as well as in the postgraduate curriculum about the leadership, but you have to play or you have to exhibit leadership role when you are past your MBBS and you have to treat in the ward and you have to teach your student and you have to teach the postgraduate trainee. When we become doctors, we become leader, but most of us are not adequately prepared for this. This article also highlighted this. We are not taught about the leadership role. What is leadership? A process of motivating the people to work together collaboratively to accomplish great things. A leader takes the people where they want to go, but a great leader takes the people where they do not necessarily want to go, but where they ought to be. And if your action inspires others to dream more, learn more, become more, then you are leader. What is the definition of leadership in Islam? This is ayat from Surah Anam, and it is he and who has made you successors upon the earth and has raised some of you above the others in degree of rank, that he may try you through what he has given you. Indeed, your Lord is swift in plenty, but indeed he is forgiving and merciful. And one of the hadaya, each of you is a guardian, and each of you will be asked about his subject. This article addresses the Islamic perspective of leadership in management and highlighted that we have to play the role as a leader, and we are answerable to Allah. According to this message of our Holy Prophet, leadership in Islam is not earmarked for small elites. Depending upon situation, each person takes a position when, with a single wave of effort, and occupies a locus of leadership. And there is a hadaya, whenever three of you are traveling, you should select one of you as a leader. And further advice is that you should obey your leader until and unless he is very obviously against the Islamic principles. This is the actual principle of leadership. What is medical leadership? Is relatively a new term. Doctors and the health professionals are frontline workers of healthcare and have a vital role to play in leadership